Hi, everybody. My name's Adam Gerber. I'm from Columbia University, and I would like to discuss some of the work my lab's been doing with matrix metallic proteinases and their ability to mediate the inflammatory response during acute lung injury. So I'm sure you're all aware, acute lung injury results when lungs are responding to an injurious stimulus and they become filled with macrophages, neutrophils, cytokines, fluid, all stuff that shouldn't be there. Matrix metallic proteinases, or MMPs, are becoming significantly recognized as major mediators of this response in terms of the recruitment of immune cells, the breakdown of the vascular barrier, as well as the activation of various cytokines that may be involved. So they may be a potential target for therapy. Notably, MMPs already have an extensive pharmacopoeia created against them. This was done when it was thought they may be effective anti-cancer agents. However, the side effects of systemic administration proved to be too great. Given that these were available for our work, we chose this guy right here, who we'll call CGS, which is a very broad-based MMP inhibitor, and it inhibits quite a lot of them. So we wanted to see if we could get around systemic administration and reduce our dosage by providing an inhaled version of it, with the idea that we could reduce side effects in patients. And using inhaled MMP to the lungs and then measuring via mass spectroscopy, we could show that we could indeed detect inhaled CGS in the lung 2 hours post-inhalation. So we could do the experiment in this manner. In order to do this, we used an LPS model of acute lung injury. Mice received inhaled LPS or sterile PBS. They were allowed 24 hours to recover. And then the mice received inhaled CGS every 6 hours for 24 hours. And in supporting our hypothesis, what we were able to show using a histologic scored tissue injury was that CGS was able to reduce LPS induced lung inflammation in experimental animals. So you can see CGS reduce the inflammatory score, and if you look at these stained sections, there's significantly less inflammatory infiltrate in the CGS slice. Not only does CGS reduce the level of inflammation, it reduces the level of edema, which is a major pathological feature of acute lung injury and ARDS. So it reduced this in terms of reducing the BAL serum FTSE albumin ratio as compared to LPS treated animals. It decreased the wet to dry ratio of the lungs in these animals. And on optical imaging, we can also show that treatment with CGS decreases the FTSE signal in ex vivo lungs. Consistent with CGS reducing lung injury, we were also able to show via Western blot, which is here and quantified here, that CGS reduces the amount of cleave caspase 3 in these lungs that have been treated with LPS, which is a marker of apoptosis. And we can show similar results using a cleave caspase 3 activity assay with CGS reducing the amount of caspase 3 detected by the assay. So one of the major mediators of the inflammatory response in response to LPS and an acute lung injury are the presence of neutrophils in the lung. So we wanted to see if inhaled CGS was altering presence of neutrophils within the injured lungs. And taking bronchoalveolar lavage fluid, you can see that CGS treatment significantly reduces the total inflammatory cell count, as well as the presence of neutrophils in LPS treated lungs. And you can see that down here as well in these images of the cytospin. There's significantly fewer neutrophils in the CGS treated animals. So we just briefly have looked to see if CGS interferes with the migration of neutrophils in vivo, which is one of our hypotheses here. And you can see that in a migration assay, CGS does indeed reduce neutrophil migration without reducing viability of the cells as assessed by MTT assay. So to conclude that brief overview, we can show that CGS can be inhaled and effectively reach the lungs, potentially bypassing toxicity issues as a potential therapeutic agent. The anti-inflammatory ability of CGS, so its ability to reduce edema, cell death, and the overall lung inflammatory score, may come from its ability to alter neutrophil chemotactic responses to injury. And again, being able to inhale this and still get an effect may allow us to take advantage of this very large pharmacopoeia that's already available to potentially treat patients with lung injury. So thanks for listening, and I will take any questions.